Many African governments initially underestimated the severity of the disease, contributing to its rapid dissemination. The devastating impact of HIV/AIDS in Africa during the 1980s and 1990s. The impact of HIV/AIDS in sub-Saharan Africa was catastrophic. The United States' response, as one of the world's largest economic and political powers, had significant impacts on the evolution of this crisis. This text explores the origins, spread, and policies adopted by the U.S. in combating HIV/AIDS in Africa, as well as the associated criticisms and controversies. The emergence of the HIV/AIDS epidemic in Africa, the human immunodeficiency virus HIV, was first identified in the United States in 1981, but its origins trace back to Central Africa, where it is believed the virus passed from chimpanzees to humans. Initially, the disease was treated as a problem of marginalized communities, such as gay men and intravenous drug users, which contributed to stigmas that hindered adequate global responses. In Africa, the spread of HIV was driven by factors such as socioeconomic inequality, lack of access to information, fragile healthcare systems, and specific cultural practices. Many African governments initially underestimated the severity of the disease, contributing to its rapid dissemination. The devastating impact of HIV/AIDS in Africa during the 1980s and 1990s. The impact of HIV/AIDS in sub-Saharan Africa was catastrophic. The United States' response, as one of the world's largest economic and political powers, had significant impacts on the evolution of this crisis. This text explores the origins, spread, and policies adopted by the U.S. in combating HIV/AIDS in Africa, as well as the associated criticisms and controversies. The number of orphans increased dramatically, with millions of children losing one or both parents to the disease. Additionally, public healthcare systems in many countries collapsed under the growing demand for medical care, international response, and the role of the U.S. Initially, the U.S. responded to the global HIV/AIDS epidemic with caution and reluctance. During Ronald Reagan's presidency, the disease was often ignored or underestimated. Only in the late 1980s and early 1990s did the U.S. begin to adopt more active policies to address the crisis. In 1988, the U.S. created the United States Agency for International Development (USAID) to begin offering technical and financial assistance to African countries affected by the epidemic. However, aid was limited and often tied to political and ideological requirements. During Bill Clinton's administration 1993 to 2001, funding for HIV/AIDS programs increased, but efforts were still considered insufficient. In 1997, President Clinton launched an international research initiative for HIV vaccines. Despite progress, the cost of antiretroviral drugs remained prohibitive for most Africans. Controversies in the U.S. response. One of the biggest criticisms of the U.S. response was the initial reluctance to allow the production of generic drugs for HIV/AIDS treatment. American pharmaceutical companies, which held patents on medications, maintained extremely high prices, making treatment inaccessible to millions in Africa. Another controversial point was the imposition of moralistic and religious policies in aid programs, such as promoting sexual abstinence instead of condom use. Many NGOs criticized these approaches for being culturally inappropriate and ineffective in reducing infection rates. The role of NGOs and civil society, while government efforts were often slow and bureaucratic, non-governmental organizations played a crucial role in combating HIV/AIDS in Africa. Organizations such as Médecins Sans Frontières (MSF) and the Bill and Melinda Gates Foundation provided treatment, education, and support to the most affected communities. In the U.S., activists like the ACT UP group pressured the American government and pharmaceutical companies to reduce drug prices and increase international aid. These pressures resulted in some significant changes, including agreements to produce generic versions of antiretrovirals, the PEPFAR program and its legacy in 2003, already beyond the period directly addressed in this text, but as a result of earlier failures. President George W. Bush launched the U.S. President's Emergency Plan for AIDS Relief PEPFAR. This program represented the largest single investment ever made by a country in fighting a single disease. Although outside the main scope of this text, PEPFAR is a direct consequence of the policies and failures of the 1980s and 1990s, marking a significant shift in the U.S. commitment to the fight against HIV/AIDS. Conclusion: the HIV/AIDS epidemic in Africa and the response between 1980 and 2000 revealed a complex scenario of neglect, economic interests, political failures, and eventual. The PEPFAR program and its legacy. The U.S. President's Emergency Plan for AIDS Relief PEPFAR, launched in 2003 by then-President George W. Bush, marked a historic milestone in the global fight against HIV/AIDS. To this day, PEPFAR is considered the largest single investment ever made by a country to combat a single infectious disease, radically transforming the response to HIV/AIDS, especially in sub-Saharan Africa, where the epidemic was most severe. The context leading to PEPFAR during the 1980s and 1990s. The global response to HIV/AIDS was characterized by delays, stigma, and inequality in access to effective treatments. In the United States, the administrations of Ronald Reagan and Bill Clinton faced criticism for their initial reluctance to prioritize the crisis. Criticisms and controversies. Despite undeniable success, PEPFAR also faced criticism. Some experts pointed out that the program was overly focused on moralistic approaches, such as abstinence-only campaigns instead of promoting condom use. Non-governmental organizations, activists, and global health experts demanded a more robust response from world powers, particularly the United States, the world's largest economy. It was in this context that, in 2003, George W. Bush announced the creation of PEPFAR, with an initial budget of $15 billion allocated to combat HIV/AIDS over 5 years. Objectives and structure of PEPFAR. PEPFAR had clear and ambitious objectives. Provide antiretroviral treatment free of charge or at an affordable price to millions of people living with HIV/AIDS. Prevent new infections with a special focus on vulnerable groups such as women, children, and marginalized populations. Offer care and support to orphans and children affected by the epidemic. Strengthen local healthcare systems, ensuring infrastructure, professional training, and access to essential medications. The program adopted an approach based on partnerships with local governments, international organizations, and NGOs. The emphasis was not only on treatment, but also on education and prevention, recognizing that behavioral change and the dissemination of accurate information were fundamental to combating the epidemic. Immediate impacts and achievements. The results of PEPFAR were extraordinary. In less than 2 decades, millions of people received antiretroviral treatment, transforming HIV/AIDS from a death sentence into a manageable chronic disease. Mother-to-child transmission rates were drastically reduced, preventing thousands of babies from being born infected. Healthcare systems in many African countries were strengthened with the construction of clinics, training of professionals, and development of medical infrastructure. Awareness campaigns were expanded, helping to reduce the stigma associated with HIV/AIDS. In addition to the direct health impacts, PEPFAR also had positive socioeconomic effects. By extending the lives of millions of people, the program helped maintain a productive workforce, reduce the number of orphans, and stabilize entire communities. Criticisms and controversies. Despite undeniable success, PEPFAR also faced criticism. Some experts pointed out that the program was overly focused on moralistic approaches, such as abstinence-only campaigns instead of promoting condom use. These policies, often driven by conservative religious groups in the United States, were seen as culturally inappropriate and ineffective in African contexts. Another controversial point was the financial dependence created. Many beneficiary countries became overly reliant on external funding, raising concerns about the long-term sustainability of programs established by PEPFAR. Furthermore, critics argued that part of the resources was channeled through bureaucratic intermediaries, reducing efficiency in the direct application of funds. The legacy of PEPFAR goes far beyond the impressive numbers of lives saved and infections prevented. The program redefined the role of the United States as a global leader in responding to public health crises. It also established a model for international partnerships, demonstrating that targeted and well-managed investments can bring concrete results, even in contexts of extreme vulnerability. Additionally, PEPFAR served as an inspiration for other global health initiatives, such as the Global Fund to fight AIDS, tuberculosis, and malaria. Future challenges. While PEPFAR has achieved significant milestones, challenges remain. Continued funding is crucial to ensure that progress is not lost. The emergence of drug-resistant HIV variants and global funding fatigue pose real threats to the gains made. Moreover, there is a growing need to ensure that beneficiary countries develop self-sustainable healthcare systems so they can continue the fight against HIV/AIDS even with reduced external support. Conclusion: PEPFAR not only saved millions of lives, but also redefined